Right, so you just push that through the femoral neck. And we're done. How ingeniously simple.
What about these modern day technologies? Making our life too easy, eh, Charles?
Oh, you're right there, Howard.
Who'd have thought 30 years ago we'd all be standing here in these state-of-the-art theatres using these state-of-the-art tools?
You walk into the theatre nowadays and all you see is 24 monitors, tubes and wires running in and out of every orifice, and a handful of sleeping anestheticists. Back in my day, if you wanted an anesthetic, all you got was gas or Gokul.
Local? We used to just inject the patient with saline. Tell them that it would block the pain. The placebo effect would work. Sometimes. We used to give our patients an old leather strap to chew on. That saved the hospital a bit of funds.
Those were the days. None of this sterile technique or wash to worry about. We used to reuse needles, tubes, even catheters.
Just a bit of soapy water to wash your hands with seemed to do the trick.
What about the sutures these days? Wait a minute. Is that Amanda Walker out there? Yes. Sorry, got distracted. Let's get back to the suture. Back in our day, all we had was catgut, or catgut. Catgut? You were lucky to have catgut. We used to have to use our own hair.
Terrible time if you had dandruff.
And if you're balding.
Different times. I remember as a young doctor, all I had was a good bio and a strong wrist. Now the kids these days, they run around with their eyeballs and maxi pads.
You were lucky to have a good bio. We just had a feather quiver. We'd have to round on the entire ward. The entire ward? The entire ward. Ha! We used to have to see the whole hospital. 600 patients all in a morning without the luxury of a pen or a quill. We used to remember all our patients, and when we got back to the desk, we would chisel it into stone tablets.
But we didn't complain, did we?
Oh, we weren't.
Surgeons were real men back then. And if these power drills help us, I remember manually screwing in pins.
Pins? That's sophisticated. We used to have to fashion our own pins out of scrap metal. Scrap metal? We used to dream of using scrap metal. We used wooden stakes. And we hammered them in with our bare hands. Hands? We didn't even have hands. Didn't have hands. Didn't have hands. We didn't have hands. Didn't have hands. We had hands. But they were just tied behind our back. We had to do the entire operation with our feet.
And that was the way surgery was taught.
Shame it's no longer the case.
We weren't taught.
Even as interns. I remember getting up at 4:30 in the morning to review my patients before ward rounds, having gone to bed at 11 the night before. And we'd get pittance in overtime pay.
Get pittance?
Pittance!
You were lucky to be paid. I slept in the morgue with my wife and 3 kids. We'd get up at 2:30 a.m. every morning, dissect all the cadavers to learn all my anatomy for the day's surgeries. We'd eat blood-soaked scrubs for breakfast, work 22 hours a day, and then we'd have to act as footstools in theatre for our bosses. We did it all for free, just for the satisfaction. Luxury.
There were 27 of us, living in the storeroom cupboard underneath the nurse's desk. We'd wake up at 11 o'clock at night, have a breakfast of headlands and staples, work for 36 hours a day, pay for the privilege to do so, and if we got a question wrong, the surgeon would take out our gallbladders without anaesthetic if we were lucky. Right.
For 6 months, we lived in the crater of a diabetic ulcer stuck between the rolls of fat of a grossly obese patient. And now at 10:30 p.m., half an hour before we went to bed, lick our patients clean, donate all our organs daily, and if we got a question right, our boss would slice us in two with an hepatitis-infected scalpel and dance on our grave singing Hallelujah!
But just try and tell that to the young surgeons of today, and they won't believe you.
No, they won't.